I would like to invite everyone under the BAME group, most especially to have the COVID vaccine administered to yourself, because I myself have a best friend, a Filipino, who died from COVID. That was last March, and it was so really sad. She was a dental nurse as well. So now we have the opportunity to have these vaccines, and we are so lucky and blessed that we have all these vaccines. I think we need to have this as an opportunity so we can prevent the virus from spreading, and then we can protect as well our family, our friends, our patients as well, and live a normal life.
Very, very proud of today. We've got staff in vaccinating staff, and we're all getting ready to welcome the public in on Monday, as well as more of our own staff. I'd be saying to members of the public, make sure you've got your appointment, make sure you know where you're coming to. If possible, and you're elderly, then get somebody to bring you in. Once you've had your vaccination, make sure that you're washing your hands regularly, that you're maintaining social distancing, that you're basically just sticking to the guidance as it is now. It should make absolutely no difference just because you've had your vaccination.
Pain-free, didn't even know it had happened. The injection itself, the procedure has only taken about 15 minutes in total, and I'm ready to leave now. It means a lot to me to be able to be so early on and able to have an injection already to protect myself and my staff and my colleagues. It's marvellous, and hopefully the next one is only 10 weeks time, so not long to wait for the full package, and from then, hopefully by then, a lot more people have been vaccinated, and hopefully we're all in a different, better situation.
Oh, it means a lot to me, because initially there was so many, I was thinking, is it right or not? But I'm so glad I had it today, because it's really good thing to have, because now you know you got some kind of protection, and you know when you're out and about, you shouldn't be worried that much that you might get the virus, but good to have it, because that way you're also protecting not just yourself, but your family members, your children, and your other members. And also it encourages other people to also get immune, because I've seen a lot of people suffer from it, and it's really good vaccination to have. So quick, and it's so efficient. You wouldn't even, some people do say, oh, is it done? Is that it? I said, yes, it's done. So it's really good. Don't be anxious. It's just quick and easy to have. And so many we've vaccinated today, there have been no issues at all. Everybody's happy. I'm really grateful that they had it today.
Vaccination centres are going live. There's one across each region, which is great because it means we're going to be able to vaccinate more people. But it's really important that people do wait for that letter from the national booking system so that they can go online or phone up the call centre to get their appointment. And we are really starting once again with those high-risk patients that have been identified through the GP system. So it's really important, like I said, to wait for that letter, but it's just great to be able to offer these appointments to people. A real big thank you to everyone, from the local fire service to the army that helped us get the equipment into place, but obviously Hertfordshire County Council and all of our colleagues and stakeholders across the whole of Hertfordshire that has helped us plan for today, to really get everything in place so that we're safe to go live. With getting people through for the vaccination, but especially within HCT itself, the school age IMS service and the whole project team that have worked together to pull this through, working with both the national and the regional team. So just to say that anybody that receives the vaccine is clinically assessed before they have that vaccination to make sure that there's no clinical reasons why it wouldn't be safe for them to have that vaccination. We have fully qualified staff on duty at all times here, as well as some virtual support if we need further advice from anyone. But everyone has been through extensive training for this, and having just seen some of the staff come through and seeing how thankful they are, hopefully people are going to realise how important it is. And we know that a number of the population have already had these vaccines out in GP surgeries, and we know that people are really waiting for it. So hopefully people aren't going to feel so concerned, because they'll have seen how many people have already had this vaccine by now. We need to try and stop this transmission, and the only way we're going to stop this transmission is people follow the rules and the guidance and the advice that is out there, and then also come forward for that vaccination. I would just like to say a really big thanks to everybody in HTT, because even if they haven't been involved in the vaccination centre themselves, we have lots of staff out there that have actually been helping us with interviews as well as helping us with other day-to-day activities to get where we are today. But in the meantime, they're also looking after all of our vulnerable patients out there in the community and preventing acute hospital admissions that everybody can see is really needed, as well as supporting people coming out of that hospital. So it's been a very long number of months that people have been working really, really hard, and they've carried on being motivated, professional all the way through this, and I'd just like to say a very big thank you to everybody.
I have had it done today and it was absolutely fine. I didn't actually even feel it, so it was better than I expected. It's so important for us to have it done to protect ourselves, our families, our colleagues, and obviously our patients that we see. Really positive that we've been able to get it done today, and after all this work that we've done over the last couple of months to set up this vaccination programme, it's just been amazing to get it done today and to hopefully move forward with this. So it's really important that patients don't just turn up without an appointment. We've got a very robust system in place. Unfortunately, the public will be turned away if they arrive without an appointment. We obviously welcome everyone to come in, but it's very important that they have an appointment to do it.